thanks for joining this meeting. I think you have prepared a very brief presentation about what's ATOME all about. Is this correct?
Yeah, sure. Yeah.
Okay, may I please ask you to start with your presentation, please?
Yeah. Well, let's introduce myself first. I'm Willem Scholten. I'm the team leader for access to controlled medicines in the World Health Organization, and I'm based in Geneva. I'm responsible there for everything around access to controlled medicine, so also for the WHO advisory function to the UN for the drug control treaties, for the medical and scientific advice. But my main work there is working on improving access to controlled medicines. And for this purpose, we started in 2007 the Access to Controlled Medicines program. And well, that's a program that runs for since then, but always on a quite small scale. We did several things like publishing most recently guidelines on the pharmacological treatment of persisting pain in children. Will be available in print this summer. But one of the other things we did is that we started the ATOME project. And the ATOME project is a project that is run by a consortium of 10 members from various European countries. It includes the harm reduction organizations, it includes palliative care and pain organizations, and it includes organizations working on policy and legal aspects. So, for instance, EAPC, the European Association for Palliative Care, is part of it. Help the Hospices in London is part of it, but also Harm Reduction International. And then we have universities from Lancaster, Utrecht, and Bonn involved, and then, for instance, in the policy area, it's the government of Romania, the drug controllers, and it's the World Health Organization. By the way, I can't see which slide is on the screen, so I hope that the technicians over there follow my presentation with the slides. Well, the ATOME project is funded by the European Commission. It runs for 5 years. It will end in 2014. And we are going to 12 Eastern European countries. In these Eastern European countries, we will do a number of things. The first task in the ATOME project was to develop policy guidelines that just address the issue of balancing the prevention of abuse with optimizing, maximizing access for treatment for medical use and also for scientific uses. And these guidelines, they are available already for some time. They are available in 14 languages, by the way, most of these languages for Eastern Europe. But in addition to the guidelines themselves, it contains a checklist that makes them very practical to operationalize the guidelines. Another aspect is that we identified a legal contact in each country, and University of Utrecht worked with that legal contact to identify the legislation that affects the availability of controlled medicines, and University of Utrecht finished already a quick scan for each country, except for Poland, by the way, and another scan, a deep scan, will follow, during which some details will be explored a bit further, but also where the barriers that have been found will be verified. How does it work out in reality? So that's one track. The other track is the policy track, and there we started with that's good. We started there with the development of first to identify for each country country teams, and we had workshops in Bucharest, where we had 2 times 6 country workshops, healthcare workers, policymakers from the government, and they discussed what are the policy barriers in their country, and they worked on a plan for improvement. Now currently we went through all this, and now we are in the countries themselves. We were already in Slovenia and in Turkey. This month we are in Cyprus, and the 9 other countries will follow later on until early 2014. Then after that we will make a report for each country or a section for each country that we want to hand over, where you are now in Copenhagen, when in September 2014 the ministers and the delegations from all the WHO member states from the Euro region will meet. And of course this report will contain a number of recommendations for each country. Well, in the meantime, you see which countries they are. We are going from the Baltic states, Lithuania, Latvia and Estonia, and then Poland, Slovakia, Hungary, Slovenia, Serbia, Bulgaria, Greece, Turkey and Cyprus. And in all these countries we will have a conference like we had today. And for instance, today, the program, to give you an impression, I will not mention, of course, all the lectures that were held, but in the morning we had lectures until the lunch break. The official opening was done by Dr. Adamos Adamou. Probably people among you recognize him as a member of ESMO. Who is working in the working group that is identifying barriers around the world, and that had previously a publication on the barriers in the Euro region. But he's also a member of the Cypriot Parliament, and he used to be a member of the European Parliament. Furthermore, we had keynote addresses by Tom Lynch and José Queiroz from Lancaster and from Portugal. We had a number of case studies by people from Cyprus. I presented myself the policy guidelines and treatment guidelines, and then there were other people who gave, for instance, an overview of the legal barrier that was so far found in the quick scan, well, and so on. And then after lunch, they split up in 3 working groups. And one working group was on pain management, one was on educational needs, and one was on harm reduction. And for instance, for the harm reduction, they said, well, medicines access is not our hugest problem. But for treatment of opioid dependence, we have only teams, treatment centers in 2 out of the 5 major cities in Cyprus. So that's one of the things. And the other thing is that some of the people in the centers don't apply the guidelines. So that are a number of things they want to work on. For the working group from the educational needs, they reported that they want to work for the patients to give information because there's a lot of opiophobia among patients. For instance, patients who don't want to take morphine because they fear that they will become dependent. Well, I personally heard that argument even coming from patients who were terminally ill. The other thing they want to work on is information on healthcare workers. And a focus will be on the gatekeepers, not on the pain specialists. But I also want to include in curriculum more training on pain treatment. And well, they said change comes through the evidence, so they also want to work on research. Then the pain management group, they found a number of barriers. For instance, that rural pharmacies don't hold any stock of opioid analgesics, and private pharmacies stock only OxyContin. And solutions for these two and other barriers that they found is, for instance, that they want to focus on the training of the multidisciplinary team to work on what to do in emergency situations, how to dispense opioids then, and they want to work on national guidelines on opioid use and titration. And a good thing that they mentioned was that in 2011 was already a letter sent to all the prescribers in Cyprus explaining how opioids can be prescribed and should be prescribed according to the law. So my feeling is that we had a very good workshop. It's always waiting, of course, what will be the result. People are often very enthusiastic locally or at the spot. But going back to work, daily life and daily work is then what counts. But there are a number of things that the local people here after the meeting said that certainly will be taken up by specific people already. So, and they will discuss, of course, further what other things they can do.
Okay. Thank you very much for this introduction, Willem. Can you hear me?
Yeah, I can hear you.
Okay,
sure.
fine, thanks. Thanks very much for this introduction. Now, there are many people in this room willing to improve the situation of patients with chronic pain. And they are waiting for answers, waiting for suggestions. What could you give them on the way? What could you give them as a message to take away? How could they become active, improving situation of these patients from your perspective?
Yeah, well, I think the first thing to do is to make yourself familiar with what could be barriers, and our policy guidelines can be downloaded from the web. So that can be a start, and also the checklist that is in that. And then a good analysis, I think, is key in order not to spoil energy on minor things. First, analyze what are the main barriers. Be sure that you work on these, and the minor things can come later. And then, of course, it depends what type of person you are and what are your strengths. I think people will make personal choices then, and some people will work on improving education. Other people will, for instance, lobby politicians to get certain things changed, like reimbursement or rules. And I think by doing this together, that's important. I don't think that anti-epileptic treatment is so much a problem in Europe, but for instance in Africa it's really a problem.
Okay. Thank you. Would you still be able to answer one question, or is it too late for you?
Sure. No, not a problem. It's only 1 hour later here, so
okay, fine.
It's not night yet.
Okay. But I think it was so clear and the ATOME was well known that we have once again to apologize. Well, was the Chris one question?
Yeah, I have just one question. It's here a symposium organized by the European Federation of IS Chapters, which is a European Federation of Pain Societies, and all the states you have mentioned are member of our European Federation. I was really surprised to learn that the European Association for Palliative Care, EAPC, is part of this consortium. EFIC was not. So was there a special reason behind that? Why was EFIC not approached?
Well, when we started with this, you need to know for the European seven framework projects, you need to bring together a consortium but it needs to be limited. And I think we have a consortium of 10 members, which is actually already a very large consortium. Other consortiums are often 6 or 7 members. So it's not anything principal, but it was just a practical issue. I hope that you that you don't mind.
I think the answer was well understood. At least he is nodding. So again, thanks very, very much, and we apologize for the delay, but you know these meetings have the tendency to be always late. Thanks very much.
I know. Okay.
And regards to Cyprus. Thank you.
Yeah, thank you, and have a nice conference
Thank
the
you.
rest
Bye-bye.
of the afternoon. Thank you.